Spinal bifidas are common congenital malformations that happen when the baby's spine doesn't form properly during pregnancy. The spine is made up of bones that grow around a tube of nerves known as the spinal cord. And these nerves connect from your brain and then to the rest of your body. And sometimes this tube doesn't close properly. And so when the baby is born, a part of the spinal cord comes out through these tubes that have not properly sealed. And it can cause a lot of problems even as the child grows into adulthood. So if you have a baby that has this condition, here's how you can better take care of them. First of all, you need to anticipate that you do not have a regular baby. You will have to be in hospitals a lot, working with pediatricians, neurologists, and specialists who can monitor this condition and provide any sort of guidance. You may also need to work with physical and occupational therapists because depending on the severity of the spinal bifida, your baby may have varying levels of mobility or muscle function. So they may not be able to walk properly and require a wheelchair or any sort of walking assistance. Children born with spinal bifida also have an increased risk for getting infections, especially in the area around where the spinal bifida occurs. Usually, surgery can be done early to fix the spinal bifida, so you will have to make sure that you're keeping the surgical site clean and dry. Also, some babies with this condition may find it difficult with feeding. So if your baby struggles with sucking or swallowing on the nipple, then you may have to work with a feeding therapist or a lactation to help figure out how you can provide the adequate nutrition that the child will need. And as they grow, children that have had spinal bifida will have problems with bowel and bladder control. So you may need to monitor their bowel routines and just plan for the fact that they may have to use diapers way later into their lives. And as mentioned, mobility challenges are one of the biggest problems that happen with spinal bifida. So you have to start anticipating things like them using braces or wheelchairs and organizing your house or the environment that they will live in to be able to accommodate that. Stay healthy.